think that sounds good.
Okay. So, thank you everybody for joining this evening for our program of understanding alternative public safety responses here in Minneapolis. This was an idea that came from the Tangletown Equity Committee probably last fall in response to some discussions we had about the 5 year anniversary of George Floyd's death, and then really just discussing and pondering how is policing in responses in policing situation changed over the last 5.5 years in the city. So this program is a culmination of that discussion, and we appreciate you all for joining. I will just say it's on the screen, but right out of the gate, we do have a giveaway prize tonight, a Bose Sound Like Micro speaker. So if you put your name in the chat, um, Andrea will put you in a drawing, and hopefully somebody will win the speaker at the end of the night. Somebody will win the speaker because Andrea does have it. Really quickly, just about the Tangletown Equity Committee. So we have three core areas of focus, including advocacy, education, and partnerships and fundraising. Some of our current initiatives that we work on is we have monthly equity resources, who it's a circular rotation where each member of the committee about every 3 or 4 months shares an equity resource, either an article, sometimes a video, a pamphlet, an article maybe they saw in the paper, anything to sort of help sort of provide more insight into equity and challenges we have throughout the area. We also work to amplify opportunities for equity in Tangletown in Minneapolis more broadly. And then finally, our next sort of engagement is really trying to reach out more to the renter community here in Tangletown starting the fall of 2026 and trying to sort of uh, ensure that they feel that they are members of the community and understand that their contributions belong as well. And then finally, we meet the second Monday of each month at 6:30. And there's information below there in terms of our committee and if you have any other further questions. And then finally, really quickly, we got two events coming up. We got Save the Food on Thursday, April 9th for 7 to 8 on a Zoom call. Just to learn about smart shopping strategies, kitchen habits, and storage tips to help your groceries last all that much longer and reduce waste. And then, secondly, we have the Tangletown garage sale coming up in early May, Friday, May 1st, and Saturday, May 2nd, starting at 9 a.m. Details can be found at tangletown.org/garage sale. And finally, I'd like to thank Dr. Phelps, Cherie, and Will. They are our three sort of moderators tonight for this. Uh, Dr. Phelps has written a book on Minneapolis and policing and criminal justice, while Cherie and Will work on what's called the Behavioral Crisis Response Team here in Minneapolis. And they'll be able to share more about how that team has worked directly with law enforcement in the police department here in the city of Minneapolis to help to respond to different crisis situations and in some ways help alleviate pressure off of the police to allow them focus more on criminal behavior. Um, so with that, what I will do is I will sort of give the time here to our three presenters. And Michelle, if you want to start off and introduce yourself.
Sure. Hi, everybody. I'm recovering from a cold and just got my voice back yesterday, so excuse the squeakiness over here. But I am a professor of sociology at the University of Minnesota, where I have been since 2013, and my work is on policing and punishment in America from about the um, turn of the 20th century forward. And most recently, my second book was entitled The Minneapolis Reckoning: Race, Violence, and the Politics of Policing in America, and thinks about the why the call to fundamentally transform policing emerged in Minneapolis in the way that it did in the wake of the police killing of George Floyd, and what changed in the several years afterwards. And the BCR, I think, is one of the sort of success stories of what Minneapolis is doing right these days, and we need more of those. So I'm happy to be here.
Shuri, would you like to introduce yourself next?
Absolutely. So I'm Cherie Hansen. I am the program manager for the Minneapolis BCR program, as well as the Brooklyn Center Expanded Response Program. I've been in this role, just this particular role, since mid-year last year, but I was a supervisor before and one of the team that sort of originally conceptualized the program. I'm a licensed therapist. I'm a licensed school counselor as well, and have a lot of experience working with high need students, as well as leading a lot of mental health initiatives and programs. So, yeah, that's me.
And well,
There, my name is Will McGrath, and I'm one of the crisis responders for the BCR team. And I have a background in social work that before getting involved with the BCR team was mostly involved with homelessness, kind of street outreach stuff. And in that role, I worked with a lot of people who had mental health and substance abuse issues, which prepared me for a lot of my experiences with the BCR team. And I've been in this crisis responder role for a little over a year now.
great. Thank you. Thank you everyone for providing those introductions. I think it really provides a great understanding and level set of the skill set and experience we have on this call tonight and the experiences you can all share with each other. Um, so I'll kick it off uh going to Michelle first, just to help sort of strike this conversation and help provide a little bit more clarity. Michelle, is there anything you can share that you have seen over the last 5.5 years that Minneapolis has done to help improve um, policing and safety in the city while also still respecting civil rights and equity within the community?
Sure. I think the first thing to say is that none of this work started in 2020. And none of this work even started if we think about kind of the early 2010s and the rise of the Black Lives Matter movement. That's not really the starting point either, right? And one of the things I do in the book is I go back, in fact, generations. And for generations, Minneapolis has been one of the cities where liberal mayors and other elected officials have sort of set their political ambitions around reforming policing. We can go all the way back actually to Hubert Humphrey in Minneapolis, which I won't spend too much time on. I know this is not the History Channel this moment, but that is all to say that this crisis around police violence is not a new phenomenon. In fact, I have a new project right now that's looking at coroner's records. We're retracing police killings all the way back to the 1910s. And while there are changes in the rate of victimization and changes in what the victims look like, this constant fear of and reality that police violence happens and will periodically set off responses from the public in outrage about what they see as unjustified police killings is a really long history. And so too is the history of police reform and attempts at change. Um, I am somebody who thinks that we can make policing better. I am somebody who thinks that we can make incremental reforms, but they take a tremendous amount of time. They take a tremendous amount of political energy, and they're really hard to sustain. And so what you often see is these sort of cycles of effort where there will be a case that is particularly egregious for whatever reason, and that particularly generates a community response. And then there's a lot of attention and a lot of energy, and there is eventual and efforts towards reform, and that eventually gets replaced as political attention and mobilization moves elsewhere. So I say that all to say that I think in Minneapolis we have seen meaningful changes, but we've seen meaningful changes in policing in the context of a lot of other kinds of upheaval in ways that we're still just starting to measure the impacts in a reliable way. And I think there's a lot of questions about how those changes get sustained. So one of the most obvious changes is that there was a quite significant exodus of officers after 2020. They're actually we didn't see the decline stop until last year. It was actually really quite recently that they stopped losing officers and started gaining officers. And so the department for a long time and continues to be standing at significantly smaller numbers. Some people see that as a win because it has reduced police citizen encounters, and some people see that as a concern because it means officers have less time in their day-to-day activities. We also have, through the consent decree process and through the city leadership and leadership at the police department, a series of reform initiatives. I think a lot of those hold promise, but I will say they are extensions of work that was happening under Chief Arredondo and before him as well, Chief Harteau. And I will say that if you read the first set of reports from the evaluators, where we're at is essentially writing better policies and rolling out better training, but we're still really waiting on things like eliminating the backlog on misconduct cases, really rolling out more transparent and better accountability processes. It is still very much a work in progress. So I also think, well, and we'll get there, but the city really innovated before 2020 and after 2020 in thinking about alternative public safety models. And unfortunately, already we've seen some of that work come under threat. So, for instance, violence interruption work really blossomed in the city and then has somewhat floundered in the years since then. So, I don't think it's a simple story of things have gotten uniformly better over the last several years. I think there has been a lot of effort, a lot of sweat, a lot of blood, a lot of tears in making things better. And I think there's been a lot of setbacks, and I think we're in a moment where it's particularly important and particularly difficult to continue to keep that political pressure on moving changes forward and making sure they actually happen.
Great. I got one or two questions for you, Michelle. Me personally, we'll come back to them. Cherie, can you share a little bit about yourself in a little bit more detail with your role and how the BCR fits in with policing in the city?
Yeah, absolutely. So just starting from the beginning with BCR, of course, we know we're a mental health crisis first response program that's been operating since 2021. We are unarmed mental health first responders that operate 24/7, embedded into 911, and for all ages and free of charge. And that piece embedded into 911 is really important because it is unique. There are many models that have been co-response models where mental health practitioners go out with police or mental health practitioners go out themselves to reach out to families, but being embedded into 911 allows us to have access to recipients and access to those who are struggling with their mental health in a way that allows us to give direct services to the city and to the people who need it most. And so we'll come back to that piece as well. So originally Canopy, it started with Canopy Mental Health, and it was founded by a group of 5 of us. And we were operating as a multiculturally focused therapy practice here in Minneapolis, and the city of Minneapolis sent out a request for proposal asking us to build a model for this type of work. We at first were not going to do it, but eventually we did and created a model and pitched it to the city, and then we ended up winning that bid. So, since then, our responders kind of hit the street in 2021 December, And we've grown since then, like from that beginning of just a few teams to over, I think we have 55 responders this present day. And of course, we're operating 24/7 and we're operating in all precincts in the city. And so what this looks like every day is, a community member calls, let's say you're a community member and you see someone on the sidewalk and they're maybe talking to themselves or they seem distressed or they're yelling and mumbling or this kind of thing. And then you're concerned for them, but you may not want to end up with police out there. So you call 911 and you say, maybe we could get the BCR, or you tell the dispatcher particularly what you're seeing. They will ask screening questions to make sure it's a safe situation and a right situation for the BCR to be sent. And then they will dispatch and that actually send our calls through the police CAD that we also have access to. And then the two responders will go out, they'll work in pairs of two and then assess the situation, talk with the individual, and try to find solutions to whatever's happening, whether that be taking them to a family member's house or being with a neighbor caring for them, or potentially going to the hospital if that's necessary. However, most of the time we are able to find solutions within the community and within the context that the individual is already living in. And so that's kind of what the process looks like. So as you can probably tell, right, with something like that, what is our role in the reform with policing? We are being sent as responders with specialized training, with mental health backgrounds from practitioners, mental health practitioners per the state statutes, all the way up to mental health professionals like licensed therapists like myself. And we have a targeted role and we can do we have this mental health expertise that allows us to be activated instead of police. And so our role in that is really allowing police to handle the calls that are best handled by them and that they are trained for, and have us handle the calls and handle the individuals in a way that is appropriate, and appropriate response as opposed to alternative response. We're an appropriate response for individuals struggling with their mental health. So it's kind of what it looks like.
Thank you. You gave a great understanding of how I feel like the BCR fits into the overall community and helps partner with the police. Will, would you like to add anything onto that?
Yeah, I mean, I think Cherie covered pretty well how we're integrated into the system. I can talk a little bit about, a standard day for me, if that will help kind of tell people what this program is like from the responder point of view. Um,
Definitely.
yeah. So I'll go in for a shift and I'll have a partner and we'll be assigned to work generally a specific precinct of the city, and that those roles will rotate around day to day and week to week. And we'll be monitoring the police computers for calls that are specifically tagged for us. So as Cherie mentioned, the 911 dispatchers they'll get a call, get a sense of what's going on in that call, and if it seems appropriate for the BCR team, those calls are flagged for us and we pick those up. Or occasionally, the 911 dispatchers and call takers will call us directly on the radios and ask us to go out to a call. And yeah, so so day to day we'll be around the office, and like any kind of first responder job, sometimes nothing's going on, sometimes everything is going on. And it totally varies day to day. Sometimes, you'll go from one call to the next, and you're in constant motion all day for a 10-hour shift. And then some days it's just the way the cards fall is quieter and there's less going on in the city, and that's a good thing too. And
It's a great.
I
Go
don't want
ahead.
to I don't want to take up time right now, but I'm happy to talk about specific calls as well to kind of give people a sense of things. But I don't want to interrupt the flow of the conversation.
No, I think that's excellent. So, I think we were going to go to questions soon, but I think it's a great example. If you want to share one of provide incremental context for people, I think is very helpful.
Yeah. So I was thinking about a call recently that a partner and I were on that I felt like was a very successful call that I think kind of illustrates what when the BCR team is working at its best, I think is this felt like a very satisfying call. So my partner and I got called out to a family dispute where um, a mother there was some kind of interaction altercation between a mother and son he was 16 and um, we got out there. The police also were dispatched to this call as well because the information was a little unclear at first. So in those kind of situations, the police, the 911 dispatchers want to make sure we're safe because, as Cherie said, we're unarmed and we don't want to be involved in a situation. They don't want us to be involved in a situation that's dangerous. So we arrived in this scene and we were in this it was a small living room. There was this mother, 16-year-old son. There were several other family members. There were two police officers and then two BCR responders. And the emotion in the room was very heightened. Some kind of altercation had happened, the details of which were a little unclear to us. And we had the information that the son was somewhere on the autism spectrum. He also had been involved in the juvenile detention system in the past. And so we had some of that information up front. And the emotion in the room was very escalated and elevated. And my so our kind of number one mandate when in a situation is we want to take the temperature down in a situation. We're responding to crises and we want to try to get it to be where we can just lower the volume on everything in that moment. Um, so my partner, who is a very experienced responder, um, also knew these two police officers who were out there with us. And after he kind of assessed the situation, said, we could tell that this 16-year-old boy who had spent time in the juvenile detention center was very on edge um, with these officers around. And my partner said, kind of in an aside to them, I think you guys can probably wait outside. The situation seems safe. And um, he started talking with this boy. I talked with the mom and went into the kitchen to talk. And our goal was just taking the temperature down in this room. And I spoke in the kitchen with the mom for a long time and let her vent her feelings and emotions and explain what was going on. My partner spoke with this boy and let him, vent his feelings and emotions on what was going on. And we could feel, you know, the hence electricity in the room was just kind of went out. First of all, is the less people we got into this tiny space, the more we got a chance to let these two people who were in conflict, get a chance to say their piece individually and feel heard by us and feel supported by us and just have a chance to vent some of that emotion. And also just feeling like this kid, we made clear wasn't going to be getting into further trouble. And, when kids are in fight or flight response situation, they're not making the smartest decisions. But if you can get that point where they can get out of that fight or flight mode, then it really helps settle the situation. So we spent a long time talking with this family. As Cherie mentioned before, there's fewer police officers and they're very overworked and they're pulled in a million directions. And so my partner and I were in a unique position to really spend time with this family and really let them have a chance to, get into what the problems were. And then we were able to, once we had kind of built rapport with this family and had a relationship, we could connect them to services. We're aware of this group called Family Rehabilitation and Support Services, which does longer term work with a family of helping them, address these kind of problems. So we know we can work with them in this moment of crisis. We can't work with them a long time, but we could spend, I believe by the time we left, we had probably spent 90 minutes talking with this family. And by the end of that 90 minutes, we had connected them to social workers that they could engage with on a long-term basis. We connected the son to therapists that he could connect with on an ongoing basis, and had these family support services. And by the time we left, this is one of those moments where, as a responder, you're professional, you're, kind of you need to be emotionally detached in a certain way. But by the end of this encounter, the family was trying to hug us and it felt like a very satisfying conclusion to this moment that we walked into a very heightened situation. And it was one of those things where we had the opportunity to spend the time deeply engaging with this moment and then giving the people connections to long-term supports that they could use.
That's excellent. Can I ask one question? Did the police stay around the whole time, or did they leave as the situation sort of calmed itself?
Yeah, they hung out front. And because, they are looking out for our safety. They want to make sure we're safe. They trusted my partner, who was a very experienced person, and, quickly got a good read on the room, but they want to make sure that we're still safe. And so they stayed outside of visual sight of this situation. But so people's, tension levels could come down, but they were ready to respond if we felt like we were in danger.
That's a good.
I'm gonna jump in here real quick.
Yeah.
Thank you, Will. That was really, to hear a day in the life of was really important, I feel like, to this conversation. Everyone who registered, you submitted a lot of very thoughtful questions, and we have a lot of them that we want to get through. So I'm going to introduce Ellen, who is also one of our equity committee members, and she sort of went through and kind of grouped and organized everything really nicely so that we can try to get to everything possible. So Ellen, if you want to jump in and kind of lead us through what people are curious about.
Sure. Thanks, Andrea. Michelle, I want to start with you. What are some of the other alternatives to policing in urban police departments like ours? Like, which kinds of reforms are feasible? I'm curious if you have some solutions, like in your perfect world, what else would be happening here or elsewhere?
Yeah. So, the core of it is this, that police officers are trained primarily around the use of force. And when I say that, it is that the police role is defined around force. That does not mean that most encounters with police involve force. They don't. But all encounters with police involve the threat of force, right? The reason that people know that they need to comply with a command, for instance, given by a law enforcement, is that there is that threat of force, right? And there is the threat of arrest, which is another kind of force, even if the person is not actively physically resisting in that moment. And so the tools that police officers have at their disposal, no matter how perfectly well trained that officer is, and I think there's a lot we can do around training, right? So if you think about like international comparisons, in a lot of other Western European countries, you have a higher number of police per capita. The US is actually really unusual with how many people we incarcerate. We have a mass incarceration problem. We do not actually have a mass policing problem in the same kind of way. It's a little tricky. It gets into like some wonky things about who you count as police, which I can get into again in a minute. But in terms of formal law enforcement, we actually have a relatively low rate of formal law enforcement. But even in places where there are more law enforcement, they are much more deeply trained. The police academy takes much longer. There are higher formal education requirements, better training. Even in those contexts, right, you are still going to see instances where police deploy violence in a moment in where it is perceived as unjustified, or in moments where it escalates the situation because people know that officers come with that threat of force, right? And so for me, the answer is always like, how do we constrain the number of tasks that we've given to law enforcement officers so they're not the default first responders to crisis? How do we reduce the number of crises that are happening in society in the first place? And I don't just mean mental health. I also mean crises around other kinds of insecurity and precarity and the ways that those create the conditions, right, for interpersonal violence. And then how do we think about what that police officer is doing if you, for the cases where you haven't prevented the harm from happening and you haven't prevented the police response, right? How do we ensure that the least amount of violence is used and that there is accountability when law enforcement violates those norms and expectations and training and legal standards. So I am really encouraged by cities thinking really broadly about how to create safety. And some of these, we can think about public safety in such expansive ways that are really different from what people code for public safety. So like, for instance, better lighting is often in urban spaces, public safety, right? Like that can reduce victimization on the street. Turning blighted lots into gardens can reduce crime. Giving young people, particularly vulnerable people, summer jobs where they are paid and have contacts with adults who have just positive engagement in their life, that can reduce victimization. And again, all of that is then going to reduce the need for people to feel like they need to call 911 in the first place, and for the public to feel like, oh, well, we need this police response, right? Because look at what's happening in the community. I'm also really encouraged by how cities are thinking about alternative responses to 911 response. So mental health crisis programs are one piece of this. There are actually other cities, though, that are doing even bigger expansions of civilian response beyond mental health response. So for lots of kind of low-level calls to 911, different cities are experimenting with different kinds of civilian-led safety initiatives. I was just looking at a paper that's looking at a project in California, in San Francisco, that takes people with former justice involvement and trains them and supports them in becoming essentially like block ambassadors for blocks on the Tenderloin that are very high disorder blocks, and providing support, essentially starting to become a connection to social workers for some of the folks who are unhoused. I'm really excited by programs that think about how do we get people into housing quicker and address like root cause initiatives for people who are unhoused. And, in the law enforcement space, more narrowly, I would say there's some really interesting stuff around how do you reorient the culture of policing, which we have been doing and changing in ways over the decades. But there's been some really I think smart stuff to come out around sort of officer wellness, what it means to sort of address the trauma that officers and other kinds of first responders and other kinds of violence prevention workers face. How do we intervene in those moments? There was an initiative through Georgetown that attempted to sort of figure out how to build in police training culture, this idea that yes, policing was a risky job, and part of that meant that law enforcement should be essentially sort of really, really hesitant to engage in violence in the community because the community had not signed up for that, even if that meant exposing themselves and that they should retreat for. So, some ideas about the training that really kind of rethink some of what traditionally we've thought of as sort of best practices. And actually, this shows up in my historical project. A lot of the police killings in Hennepin County in the 1920s, 1930s, and 1940s are actually officers shooting people who are fleeing from robberies. And that is something that you see much less now because we have changed the culture and expectations and rules and training around it. So yeah, there's quite a few things that give me hope.
Thank you so much. That's super interesting, and hopeful for sure. Sheree, I was looking at some of the questions in the chat, and some of them are also connected to ones that people submitted when they registered. And one of the ones that a bunch of people had questions about was about the how the dispatching works and how does someone decide that a call should go to the BCR? Do they do a good job of that? Do you think more of the calls could be going? Talk a little bit about how that dispatch process works.
Yeah, so when when folks call into dispatch, when they call 911, you can either ask for the BCR and then they will go through some screening questions. They will ask about whether there is a weapon. Dispatch will ask about, or the dispatch will have access to the priors associated with the address that that person may be at. And if there's information about that potential recipient, then they'll have that knowledge to help them decide whether it's a BCR call or not. And dispatch is well trained. In fact, we train them over time on what questions to ask and what our scope is and what our responders do. So I would say, like anything else, it's not always perfect. I would say that um, like when they hire a new staff, we'll see this when they hire new staff, like there'll be a learning curve about like what calls BCR should be on and what calls BCR should not be on. But generally speaking, I do think that they do a good job. And in the beginning, I think it was more difficult, but over time, you've seen it get way, way better as everybody gets used to the role that BCR plays in the community. And so additionally, like, let's say a person calls in and they don't know about BCR or they don't know to ask for BCR. If someone reports something that dispatch catches as even sounding like it could be a potential mental health issue, they will ask screening questions and send BCR. A situation like that might be, if there's someone who's out in the cold and it's like really, really, really cold. And at that point, let's say if we're at negative 20 degrees and we see an individual who's really hanging out outside for a long time, there's some indication in there that mental health could be an issue. And so sometimes they have us go and assess and then evaluate the situation to see if mental health is an issue and then get them to the right place or have connected them with a resource that can keep them safe. So that's kind of an example of how the screening works and how we get put on calls.
Thank you so much for that. I don't know if this might be a question for both you and Will, but I'm curious if you could speak a little bit to sort of police officers' reception of the BCR team and how, like, what value do they see of the BCR team? How are you working together? I don't know, Will, if you want to answer that with your interactions that you have with.
Yeah, I can just speak to my own experiences, but I've had very positive interactions working with the Minneapolis Police Department. I think I feel like my the things that I've seen are officers who are grateful that we are going to a situation that they don't, I mean, this is my perception, that they don't really feel like they are trained to engage with. And, in the same way, there's plenty of situations where I don't feel that I would be, trained to engage with. I think officers are generally very grateful that, we're going to a call where we can use our skills and they don't have to feel frustrated or put into a weird position trying to solve a problem that they have different tools for. So in my year plus on the job, I've had very positive interactions with MPD of feeling like um I've never been on a call where it didn't feel like we felt like we were working together to solve a problem. And I've honestly seen a lot of, well, as Cherie was talking about a lot of, and Michelle as well, a lot of new recruits coming in. This is very anecdotal for me, but I feel like a lot of the newer recruits coming in have received some training to lead with compassion in situations that maybe was not the case in the past. I don't really know, but I've had pretty positive experiences working with people who MPD who seem like their instinct is towards a compassionate resolution to a situation.
Yeah, thank you. And Anissa has a question in here, and we also had a question submitted beforehand. And Michelle, this might be one for you, but can you talk a little bit about this proposed training facility? I saw in the news today that they're delaying the vote on it, but what does that like? There's obviously lots of concerns about it, but are there like what are the pros and cons? Tell us more about this training facility and what it entails.
Yeah, I'm going to be perfectly honest. I actually had a family member who was in mental health crisis recently, so I have been totally plugged out of this news, except that I saw an article about it today where council member of Utah said, "This is not Cop City. This is at best a cop corner store," which is like just an incredible quote. But I will just say I don't. I think the parallel is being made with the Atlanta Cot City, which was truly a sprawling complex. This is a smaller intervention, at least in terms of the scale of it. I can't speak intelligently to sort of the training needs of MPD and what this facility would fill in or not. I haven't looked into it enough. I would say in general, I think there is always sort of this tension, and we saw this in 2020 and the years that have followed, that training and investment in law enforcement takes money. And also, if we want to build alternative public safety models, it's really hard to do that while we're sinking more into policing. And so there is always sort of this tension of where the budget dollars are going to go and what they're going to go into it for. And is it actually a good set of a good investments? And I will say, in general, policing budgets are sort of more oriented towards paying staff costs, which I think is the more kind of effective use of funds. So it can be difficult to get these kinds of training facilities. But I don't know what they're relying on now and how adequate or not adequate they are. So I can't really speak to that piece of it. Sherry, you might know more. I don't know if you've been in these conversations at all.
I have not been involved in these conversations either, with the exception of just pretty much what the public knows, that it's mainly focused on training. And, and for us at our current location, we have facilities that we use for training. That's not to say that it's always feels adequate, especially at certain points in the responder training. But, our minds are still open about this because honestly, there's just not a lot of information at this point. It is almost like hypothetical because does it seem like there is a lot of, I don't know how this will move forward with the council. So.
I see Marie's hand is up. Did you want to ask a question?
I just want to comment that I was at a meeting last night with Jameson Whiting about the proposed building. And it seems pretty clear to me that they don't really know yet what's going in there. So it's a little frustrating trying to get specifics on the proposal.
That's why they delayed the vote, because there wasn't enough, you kicked the can down the road a little bit there, but so one of the questions that came up both in a couple people asked when they submitted the registration questions, and this might be a Michelle question, is about the impact of ICE's operations on Operation Metro Surge, and like how that impacted what was MPD's involvement, and how did it, if it did, change people's perceptions of MPD? What's the landscape look like that in terms of ICE and MPD?
Yeah, I answered. It's always strange when the city hits crisis moments around policing. I feel it very personally, but I feel it in this weird sideways ways of suddenly like national, international reporters are like pounding on my doors, and I'm glued to watching the coverage so that I'm like up to date commentary. And so it feels like I live through the crises in this weird sort of meta remove because I'm now the like Minneapolis police sociologist people call. So I talked to a lot of reporters. As we were going through that just really intense period and with a lot of violence, including, of course, several deaths. So I would say that there was the police department was in a really tricky spot. So historically, law enforcement at the so most police departments, let's just start with the basic, like most police departments are hyper local. I mean, even in Minneapolis, we have the MPD, we also have transit police, the park police, we have the University of Minnesota police. Most police forces are local. There's over 17,000 police departments across the country. And that's one of the reasons police reform is so hard. So in a lot of the kinds of countries that we like to compare ourselves to, there is a federal structure that provides a lot more oversight than we see in the United States, or even state level oversight. The United States is very much devolved to the local level with just a little bit of state and federal oversight. So most of the action is with local policing, and people honestly like forget that the federal government has this law enforcement capacity. Or I see most white Americans, anyways, is who are not living in sort of along the border. It is easy not to. And not during the Trump administration, but it has been easy, I think, for some Americans not to pay attention to federal law enforcement. But typically, local law enforcement is pretty aligned with federal law enforcement. So when the feds were in Minneapolis in the past, it was often around targeted federal criminal cases against folks, for instance, drug cartels, where local police and prosecutors were working with federal law enforcement and federal prosecutors to work together on these cases. And so to have a federal agency that was deployed so explicitly as political retaliation from the president in these ways that really went far beyond the kind of scope of what we'd seen law enforcement do before. I mean, so many things were out of the ordinary, right? The masked identities and the refusing to wear badges, something local police could never get away with, right? The explicit sort of public justification that we're going to stop and search and potentially abduct anybody for anything because we think you look a certain way. The secret memos about actually the Fourth Amendment doesn't matter and you can do what you want. I mean, there were so many ways in which this intervention was really profound. And so the MPD was put in this position where they are both law enforcement agencies, and yet the public was asking the MPD to stand between them and ICE, right? To stand between them and the Department of Homeland Security. And quite literally, that was happening at these crime scenes in these moments where federal agents shot and killed Minneapolis residents. And so, in some ways, the department was put in this really impossible situation, and a situation in which I think anything they did was going to be really tricky because they were facing multiple loyalties. And I think a lot of people were disappointed that the MPD wasn't more aggressive in trying to thwart ICE. They were outnumbered, and they And so it's hard to know sort of how, and they were working a lot of overtime because of these, particularly the crime investigation scenes and then the protest sites. And so I think they were really trying to thread the needle. I was at the big march down Lake Street after the Powderhorn protest, and it was really, I think, moving to me how quiet, how little, how unobtrusive, unnoticeable almost the MPD presence was in some of those. They were really trying not to further escalate. And among some residents, I think in a funny way, it actually improved their perception of the MPD because there was a sense of like, oh, well, they're so much better than that. Like the floor got just so depressingly lower. Like at least our local police aren't masked and de-identified and these goons cruising the streets trying to like abduct children, right? And so the fact that the chief was willing to push back against what Department of Homeland Security was doing, at least in press conferences, if not sort of more active resistance in sort of everyday encounters between officers and ICE. I think there was actually a moment there where there was a lot of trust built in the MPD among people who were very in the know, right? And who found themselves saying like, oh my gosh, I think I'm particularly very in the know and very critical of the police. There are these people who are like, I think I'm in love with Brian O'Hara right now, right? Like, what is happening? But I think for a lot of immigrant families, for a lot of families who, are not glued to social media and the online news, I think for a lot of those families, the distinctions between what was happening by the MPD and what was happening from different federal agencies, they're wearing badges or they're wearing vests that say police emblazoned on them, right? Like the whole point is to create this confusion between what local law enforcement are and these federal agencies. And I'm sure that had an effect too, right? That people in general were worried about law enforcement and weren't necessarily always distinguishing between agencies. So I think it had a lot of impacts in lots of really complicated ways. It drove a really important a component of our community into their houses and in quiet. It also happened when it was so cold out, right? So it was also like a period where like 911 calls were down, but overall 911 call down dipped during that period, which is interesting. I think people were afraid to reach out. And I think obviously the kind of economic and social and emotional consequences of Operation Metro Surge will continue to have really dire impacts locally. And I'm sure will show up and are showing up in the BCR's work.
Yeah, that's kind of what I wanted to ask you, Cherie, is how did those operations impact your work? Like what your responders were having to do, what kinds of calls you were getting, the volume, anything that how did this impact your workplace?
Yeah, and even Will might be able to speak to this as well, but what we noticed was that the call volume did seem to go down uh, in some ways and in some days, right? I would also say that the biggest impact that I noticed was on the responders themselves. The work is already taxing and intense, and requires a lot of um, presence and maybe even emotional energy. And having that extra layer of ice, not knowing whether they will end up on our calls, whether we will encounter them. This was something that was affecting the responders emotionally. And, we have been lucky enough to have a lot of diverse individuals that work for this company. And there are many people who are part of communities who were being targeted by ICE, that were very even afraid as they were doing their work, that they might even be targeted by ICE. And so I think it's already difficult work, and I really felt like I saw morale really kind of naturally go down because there was fear and there was uncertainty. So that's mainly what I saw.
Thank you so much. I see we're 2 minutes from our time here, and I don't know, Andrea, if you need a minute to do your drawing or if there's any last questions that folks want to ask.
I think I will, I was just putting in the chat, put your name in. So now I'm mid that. Hold on one second. Why don't we do closing here, and I'll do a drawing from the offline and email the person so that I'm not taking that time tonight since there's
You have
so many
you have folks'
questions.
emails from
Yeah,
the registration.
I do. Yes.
Okay, perfect, perfect. Thank you so much. Well, I just want to say thank you to everyone for coming out on this Thursday evening, and to Michelle, Cherie, and Will for taking the time to chat with us. It's really great to hear all your perspectives and your expertise and all the hours you put into thinking and working towards a better, equitable, law enforcement system. So, thank you everyone for coming, and if you are interested in joining the equity committee for the Tangletown Neighborhood Association, please, I guess, email Andrea. But it's great to have you and to see you all. So have a great evening.